Today we have Professor Harold Carson coming to the 6th International Psychopharmacology Congress in Antalya, Turkey, and we would like to ask you a few questions about metabolic side effects of psychotropic medications. Professor Carson, first of all, welcome to Antalya.
Thank you. It's wonderful to be here.
Thank you. Now, one of your areas of expertise is psychotropic medications and their metabolic side effects, particularly. And when we say psychotropic medications, one of the oldest but still very commonly prescribed medication is lithium, and it is still one of the most effective medications for treatment of bipolar disorder and some other indications in psychiatry, such as treatment-resistant depressions, etc. So I just wanted to get your impression about that.
Well, the main thing we have to think about with lithium is its effects on the thyroid gland.
Yes.
And as perhaps most of the audience knows, it can cause hypothyroidism, an underactive thyroid. We're not quite sure how often it happens in children, but in adults over years it can cause hypothyroidism in up to 20% of the females, of the women, and a smaller number of the men. But it's quite a common side effect.
So hypothyroidism obviously is a serious medical condition, particularly it can cause slow metabolism and weight gain and the complications that may result in significant obesity and cardiovascular side effects. So what should be new graduate psychiatrists should consider when they start their patients on lithium regarding that side effect?
It's probably wise to obtain a measurement of serum TSH, the main indicator of thyroid function, before you start the lithium to know where the patient is beginning.
Sure.
And then monitor the TSH periodically through the lithium therapy. In the first year, it probably should be done around 1 month, 6 months, and then a year. You could add a 3-month measurement if there was something borderline as well. And if nothing has happened after the first year, then probably yearly thereafter.
Yes. So that will be one important side effect psychiatrists should keep track of. And also when we talk about psychotropics, particularly antipsychotic medications, we do see another side effects, prolactin level elevation. And that obviously can cause serious side effects both in males and females. We just wanted to hear your recommendations for new graduate psychiatrists about that side effect.
Yes, I think the most important thing is that someone, presumably the psychiatrist, needs to ask the patient about these side effects frequently. You need to do more than just measure prolactin. In fact, you probably shouldn't measure prolactin if the patient has no symptoms.
Okay.
Who cares what the prolactin is if there's nothing wrong? So ask about the symptoms, which means ask about the menstrual periods in females, ask about nipple discharge in both genders, but particularly the women, and ask about sexual functioning in both genders. Okay. Those would be the main things to ask about. And if all of that is fine, don't bother to measure the prolactin. You don't need to know what it is.
Okay,
so everything's good.
So the important message here is really being a good clinician, doing a good observation, evaluation, and doing our questioning interviews about the potential side effects and what physical complaints or results patients will see.
Exactly.
And good clinicians should be aware of that. So how about the weight gain? As you know, the obesity is 130% above the population in the US, and the other 1/3 is overweight. So there has been an epidemic globally, and unfortunately, a good number of psychotropic medications do cause weight gain.
Yes, many of the second-generation antipsychotics, the atypicals, do cause some weight gain. Of those, olanzapine and clozapine have the greatest effect in causing weight gain, but all of them do to some extent. We need to be aware that that's going to happen. We need to tell the patients it's probably going to happen. And we need to give them some advice before they even start the drugs on how to minimize the weight gain, which is the usual hard work of diet and exercise.
Yes.
Occasionally, we would use some additional medications to minimize the weight gain, and of those, the diabetes drug called metformin has been quite useful. It's been around for many decades, and it's quite a safe drug, and it's understood. There are other weight gain medications as well, but they all have side effects, and if we can get away without using them, it's better.
Certainly, every medication has some side effects, but obviously we need to weigh the benefits and risks of that. But I wonder, I think it's good for psychiatrists to know about the mechanism the metformin works, because that's a very useful tool for some of our patients, indicated clinically.
Yes. The problem with the atypical antipsychotics is that they cause insulin resistance. They make the body resistant to the action of insulin, and that then leads to many of the other things, to some extent the weight gain, the high glucose, the elevated lipids. All of those are a consequence of insulin resistance to one extent or another. Metformin decreases insulin resistance. It does the opposite thing.
Okay.
And so by doing so, it would minimize both the weight gain and all those things that happen in addition, the glucose, the lipids, and so forth.
So that's a very important mechanism and should be used when appropriate, when there's an indication clinically. So I think one last topic I would like to cover is polycystic ovarian syndrome.
Yes. Polycystic ovary syndrome is a very common disorder in the general population. It's important for psychiatrists to know about because one of the drugs that you may use, valproic acid, valproate, seems to cause this in at least some patients, particularly in younger women, in teenage women and women in their 20s, not so much in older women, and in the younger women in particular. The syndrome consists often of a lack of normal menstrual periods. They have few menses or none at all sometimes.
Okay.
They often gain weight along with that, and very commonly they have too much male hormone, testosterone, and the things that happen because of that. Hair growth on the face and chest and places where it shouldn't be, and often acne. Both of those are due to the male hormone. So patients who are given valproic acid should be asked about these things. So you need to ask how the menstrual periods are. You need to ask the patient if they're having problems with acne and hair growth. If any of those are happening in a patient on valproate, you need to do what you can to minimize that. In terms of the weight gain, it might include diet and exercise. Sometimes starting a birth control pill, an oral contraceptive, will help regularize the menstrual periods and also counteract the hair growth and the acne. So that can be very useful. Also, another thing, of course, is to switch from valproate to some other mood stabilizer, whichever one you would like. Lithium, perhaps, carbamazepine, if you would like. Those drugs don't have these ovarian side effects.
So that's really great. We were able to cover 3 common side effects we see in psychiatric use of psychiatric medications. Also, I think the take-home message for me is for our new generation psychiatrists, residents, and new clinicians to come to these or similar meetings to learn about these side effects and also new developments, advances in psychiatry and other fields of medicine. So we do have an endocrinologist, for example, in our International Congress in Psychopharmacology. We do thank you very much. We hope you enjoy your time in Antalya, and we're looking forward to seeing you in the future congresses.
Thank you for inviting me.
You're very welcome. Thank you very much.